My name is Brooke Massingale, and I will be doing urinal placement on my patient today. So when I come into the room, I'm going to make sure that I wash my hands with warm water and soap for at least 30 seconds. And I'm going to apply a clean pair of gloves. And then I'm going to come over to the patient. I'm going to check his patient identifiers. And I'm going to introduce myself. Hi George, my name is Brooke. I'm going to be your student nurse today. And we are going to be using the bathroom and a urinal. So what I'm going to do is I am going to make sure the bed is in a comfortable position, and with the urinal that George is his head is slightly elevated into a Fowler's position. I am going to take my blanket down, and I am going to make sure that I have my basin of warm water at the end of the bed with a washcloth and a towel, so that way I can clean the perineal area or the genitalia after the patient has urinated. And I'm going to lift the patient's gown. George is a female, so it would be a little bit easier in this case to use maybe a bedpan, but if George was a male and had a penis, I would place the urinal over the penis and let him urinate, and then I would remove, and then I would measure it if necessary, if the output is necessary for the patient, and then I would take my washcloth with warm water. I would wash the patient's genitalia and perineal area, and then I would take and I would also dry the area with my towel. I will recover George and replace any bed sheets, slip sheet, anything like that if necessary. If there has been a mess made, I will cover it back up, and then I will cover my patient back up and leave their call light if necessary, and lower the bed back into the lowest position. And I'm going to make sure that if George can come to the edge of the bed and use the urinal himself, that I allow him to do so. We want to make sure that our patient does everything that they're able to do, and that we are not controlling their dependence or their independence on us. So we're going to ask him if he needs to come to the edge of the bed and stand up and use the urinal, or if he would like to sit down and use the urinal, or if he would like assistance. Make sure that after my patient uses the urinal that I am giving him additional warm washcloth to cleanse his hands if necessary. Okay, now I'm going to be demonstrating the use of different bedpans for my patient. So I am going to take and uncover George just to where it needs to be. Keep his privacy as much as possible. I'm going to lower the head of the bed and facility protocol. Okay, now George is flat. His head and neck are supported. I am going to, if George can independently move on his side, I will ask him to do so. In this case, he cannot. So I will move him over. I will remove just what we need to for privacy. And then I'm going to take and I am going to insert my bedpan and have George roll back over on top of it, make sure it's placed appropriately, and let them urinate. And then when I am done, I will ask if they can lift up, then I will pull it out. If not, we will roll him, we will hold it, and we will roll him back over and very carefully pull it out to go dump it. And then I will give George, or I will clean the perineal area and the genitalia, and then dry it. I will give George a warm washcloth to cleanse hands if necessary. And this is just another bedpan we can use. So I will move, show only what is necessary, have him come back over the bedpan, And this one actually has a handle. This bedpan has a handle for easier access. And then if they can lift, again, ask them to lift, and you would pull it out and remove. And the same thing, you want to make sure that you are cleaning the genitalia and the perineal area, and you are using good hand hygiene afterwards. My name is Brooke Massengale. I am going to be performing, assisting with transferring from bed to commode. I'm going to come into the patient's room. I'm going to wash my hands for at least 30 seconds with warm water and soap. I'm going to be practicing good safety precautions, privacy, and body mechanics for myself and for the patient. I will be lowering the bed to the lowest position possible to prevent injury or harm to myself or the patient. I have my gait belt, so I am going to make sure my wheels are locked. And then I am going to position my gait belt on the abdomen of the patient. You're going to want to make sure that your gait belt is in the right place and that it is not too tight, but also not too loose. You want to be able to get 2 fingers in there. Okay. Okay, we're going to let George know that we're going to be transferring him to the commode. So I am going to set up the head of my bed to make it easier for him.
Okay, ready? Yep, 1, 2, 3.
Okay.
I'm
All right, George, we're going to be moving into the commode. I am going to have him bend his knees for me. So we're going to bend the knees, George, and then I'm going to have him bring them over to the side of the bed. I'm going to assist him with sitting up. And then from here, I'm going to let him dangle his feet to acclimate himself to the floor, however long he needs. And I'm going to ask him, do you feel lightheaded, dizzy? And then if he is not, I will continue. And I'll say, okay, on 3, we're going to stand up. And 1, 2, 3.
You're going to raise the bed to a comfortable height.
Make sure that he's not putting his hands on my shoulders. If he needs to, put them on my waist to prevent injury to myself or him. And then from here, we're going to acclimate. We're going to make sure he's not dizzy or lightheaded. And then I'm going to say, okay, George, we're going to move over to the commode on 3, and I'm going to have him dance with me, making sure his feet and my knees, or his feet and my feet and his knees and my knees are aligned.
So you're going to make
go
sure
1, 2, 3.
Raised.
I'm going to have him feel around a little bit, and we're going to sit down. Before handling my patient, I will always be putting on a fresh pair of gloves as well.